One of the most common conditions that will respond the greatest to upper cervical intervention is a category of disease that I like to classify as the dizzy spins. Could also be a classification as vestibular disorders. And in that, many people may recognize certain names that come with it. We have things that are this idea of being dizzy, right? The idea of vertigo. You could have the idea of tinnitus, ear fullness. You could have this descriptor as Meniere's disease. You could have mal de débarquement and the feeling that you're on a cruise ship. Or this idea that you're swaying back and forth or you're swaying side to side. And every single one of these is nothing more than a medical way to localize the area of the vestibular system where they believe there is a problem so that they can provide a treatment or an intervention to resolve said problem. And unfortunately, sometimes this is a mixed bag of tricks and it doesn't always work, right? Sometimes you have to do the Epley maneuver. It causes your vertigo to get worse. Sometimes you do a procedure where they inject something into your ear. Maybe does something, maybe doesn't do anything, mixed bag of tricks. And you find that over time, you're, taking a ton of meclizine, you're working through all these various different drugs to try to navigate what is a vestibular disorder. From an upper cervical perspective, the vestibular system is governed by your brainstem. Now, clinically, there is an argument. Does your brainstem extend as far as the first and second cervical vertebrae? Some people will say yes. Some people will say no. That is a study for a different day. However, clinically, does the upper cervical spine, meaning the C1 and the C2, have neurological implications into the performance of the vestibular system? And the research is overwhelming. So today, what I would like to share with you is that once you have a problem with your upper cervical spine, let's say it happens in a wreck, let's say it happens in a fall, let's say you step awkwardly off of a cruise ship and next thing you know, you are perpetually dizzy. Let's say you sleep funny. Let's say something happens that causes you to have this neurological presentation that is unresponsive to traditional medical intervention or the physical therapy intervention. And you've already gone through balance and rehab and coordination and training and all these things, and you're still finding yourself at a loss. Well, more than likely, the problem is located in the upper bone of your neck. And this problem is due or is causing clinically the symptomatic presentation you have because there is a misconnection, a misfiring between your brain and your body. And what we find in the upper cervical office is that when you have what is called neuropathophysiology, meaning that you have a replicated ability to measure a interference to the neurological system by means of thermographic evaluation, that your symptomatic presentation is more than likely caused by a structural deficit at the first or second bone of your neck. And the only way to correct that is by taking an X-ray or a cone beam CT to visually see the malposition of that bone. And then once we can deliver a chiropractic adjustment, when there is neurological interference present, as evidenced by a thermographic reading, corrected by visualizing an adjustment on an X-ray, and then reevaluating it post-adjustment with a thermographic evaluation, over time, you will eliminate your dizzy symptoms, your vertigo symptoms, your tinnitus, your ear fullness, your Meniere's diagnosis. And this has happened time and time again. Oftentimes we see that when you restore normal biomechanics to the neck, it will improve normal neurophysiology, and over time will allow the intelligence of the body, which is far greater than anything we will ever accumulate in form of AI, in form of scientists, in form of computers, in form of the world, will magically heal itself. So my encouragement to you is this: if you are someone who suffers with vertigo, if you are someone who suffers with Meniere's, mal de débarquement, ear fullness, someone with tinnitus, someone that is dealing with these deficits that are neurologically damaging to your life, that impede your ability to be mom, to be dad, to go to work, to work out, to function as a normal human being, that you seek out upper cervical intervention as the only way to fully transform your life, to get you off the reliance on the drugs, to have you stop going to all these neurological appointments where they don't really know what's going on, so they just keep changing the medication, to stop having to go to neuro rehabilitation and balance and coordination rehab, to stop laying on the edge of your bed doing Epley maneuvers, trying to figure out if the crystals are ever going to get positioned correctly, and to actually go to someone who has the answers, who can show you with the evidence of a graph, the evidence of an x-ray or a cone beam CT, that you have a misalignment in the top of your neck that needs to be corrected. And once that is corrected, you will have restoration of health. That, my friends, is the simplicity of upper cervical care. And for those of you who are suffering and you see this video, recognize that you no longer have to suffer. The choice is now yours to actually find hope, to actually find a solution, and to get restoration of your life. That, my friends, is today's message on Health 101 and upper cervical care. Vertigo, Meniere's, mal-day debarkment, ear fullness, tinnitus, all of it can be fixed by simply checking your upper cervical spine.